It's time to change this patient's undergarment. We prefer not to call them diapers. You can call it adult brief or undergarment. Before I entered my patient's room, I washed my hands, and as I entered, I shut the door behind me to give him privacy. Hi, I'm here to change your undergarment. Can I lay your head down a little bit? Okay. Laying their head down will make it a little bit easier for them when they go to roll to get the old undergarment out from under them and the new one back on. And I'll raise the bed to a position of comfort for myself so I'm not bending. Now I'll lower the side rail so I'm not leaning over it. I'll don my clean gloves. I've brought my new undergarment, and I brought some wipes. I'm going to lower your blankets, all right? I don't want to get them soiled, so I'll move them out of the way. And I'm going to raise your gown. Always let your patient know what you're doing before you do it. We'll remove the old undergarment. Re-secure the tapes if you can to itself. That prevents it from sticking to your patient's skin as you remove the undergarment. As you remove the undergarment, don't be tempted to remove it and wipe down. That can force stool into the vaginal opening or into the penis, causing a urinary tract infection. So as you pull, gently lift and take it down. There's no stool, it's just wet from urine. So I'll wipe from front to back and put that into the undergarment. Now I don't want to pull this out from under the patient. I'm going to ask him to turn to his left side, then I'll clean the buttocks and put the new undergarment under him. He's turned to his side. Now I'll wash the anal area. Make sure there's no urine on the buttocks. I'm rolling the undergarment in on itself so that I don't soil his bed sheet. Now I'll grab the new undergarment, making sure the tapes are at the top. I'll tuck these tapes under the old undergarment and position it so that I know it's going to be centered properly on my patient by bringing it up and making sure I've got enough room for the tapes. And I do. Okay, you can roll back. Now I'll put up the side rail and walk around to the other side to remove the old undergarment. I stay closest to my patient at all times. And now if you could roll to your right side. Now that he's on his right side, I can carefully remove the old undergarment. I'll dispose of this in the trash. You can lay back. If my gloves had gotten soiled with stool, I would change my gloves before touching the clean undergarment. I'll secure the tapes. Walk around the other side so I'm not reaching across my patient. Secure the tapes on this side. I want to make sure I have a snug fit, but that it's not so tight that it's going to cause skin breakdown. And you can see this outer plastic, make sure it's on the outside.
Good.
If it's tucked underneath, that can cause skin breakdown as well. And you don't want to fold this down because then this part that gets moist could get his gown wet. I'll remove my gloves and dispose of those. Now that my gloves are off, I can lower his gown, raise his blankets, put his head in a position that's comfortable for him, and he said he'd like it up a little bit. And of course, lower his bed to the lowest possible position. Lastly, I'll wash my hands, and if the patient is on I&Os where we're tracking his intake and output, I would document that it was urine output and that it was 1 saturated undergarment. And there were no unusual characteristics of color or any foul odor. And I also want to note that I didn't detect any skin breakdown, because with undergarments, sometimes that can increase the likelihood of skin breakdown due to all the moisture.